record, I don't have private health insurance, but that's because I'm a bit of an idiot and I never get around. Is it, or is it political? No, I don't think it's political. And I think that probably leaves me open to some fairly hefty accusations of hypocrisy. So here's the thing. The Daily Mail reports today that growing numbers of patients are paying for life-saving surgery because of huge NHS waiting lists. It's an odd story, I believe, because, well, the source for it is private health companies. So there are times, as it spreads all over the front page and page 2 of the Daily Mail, it looks a little bit like an advert for private health companies. I mean that. I'm not being funny or facetious. It does read a little bit like, are you on an NHS waiting list? Could you afford to go privately? Well, here's Steve. He paid £10,000 for a hip replacement at the end of May to avoid a 2-year wait on the NHS. I think in the interest of full disclosure, it's a good podcast, though. You should download it. But in the interest of full disclosure, my mum's had a hip replacement on the NHS, and there was a bit of a waiting list, but not anything like 2 years. And all of these things will have got a lot longer, I think, because of the lockdown. The lockdown has caused a bottleneck. One of the biggest confusions for me with regard to the NHS's role in the lockdown was the constant argument that lockdowns were lengthening the waiting lists. And if we loosened the lockdown, somehow non-COVID medical interventions would have increased. Most of the medics I've spoken to, and again, if I've got this wrong, you know what to do. Most of the medics I've spoken to argue the precise opposite. They say that the more we keep a lid on COVID infections, the fewer people are coming into hospital with COVID, and the fewer resources and personnel are directed exclusively at COVID-related conditions. So I don't quite understand this argument. I've seen it everywhere, that the lockdown has caused the lengthening waiting lists when it's the coronavirus that has caused the lengthening waiting list. I think that's pretty obvious. But again, I've seen it in so many prominent places that I wonder whether they can see something that I can't see. So the Daily Mail today, as perhaps you would expect, reads a little bit like an advertisement for private health. And the reason I mention my own financial situation is because as a young man, I was adamant that money should not buy you any advantages in terms of health or education. And this is one of the areas where age has withered me. If I was on my uppers, would I still argue that? I don't know, to be honest with you. But here's the starter for 10, right? Ready? What's wrong with this? If I pay £10,000 to get a hip replacement, and this is, by the way, is not a rhetorical question. I'm thinking there's probably a lot wrong with it, but at the moment it's eluding me, and I need you to remind me. If I pay £10,000 for a hip replacement, you go ahead of me on the way. Say you're one behind me on the waiting list, on the NHS waiting list. We're both currently waiting 2 years. I'm waiting 2 years. You're waiting 2 years and a day. I pay 10 grand to get it done because I can afford it. And you move up one notch. I think that during the first decade of this millennium, and certainly thinking back, and this is going to be largely anecdotal because I was young and I thought I was immortal, the advantage bestowed by private health insurance seemed to be smaller than it was under Margaret Thatcher. That's just an overview that you're welcome to challenge. So for me, the problem comes when you've got a really, really, really long waiting list and huge advantage to be gained by paying. What you really want is a national health service that is so good and so fit for purpose that the only benefit of going private is to get your own room and nicer sandwiches. All right, so Dad had private health insurance when he was on the Telegraph. And going back now to, crikey, 1989 probably, he went into hospital for an operation, and me and my sister went to visit him even more than we would have done ordinarily because he had like satellite telly and stuff or the equivalent. He had more channels in his hospital room than we had at home, and that was because he had private health insurance on the Daily Telegraph. But as I recall, and this is actually this is under Thatcher, isn't it? As I recall, he didn't get treated quicker as a consequence of having private health insurance. He simply got better accoutrements, a nice menu, amazing menu. That was another reason we went to visit all the time. I could watch a movie and have a prawn sandwich or something like that. It was all on the insurance. So that I'm fine with, okay? I don't know whether that upsets you. If it does, tell me why. But I'm absolutely fine with that. The idea that we've got a more or less equal access to health, but if I've got a few quid, I can have a comfier bed and a fluffier pillow. As long as you're not sleeping on stones, there's a basic level which everybody is entitled. It's all about the basic level, surely.